HRT has dropped dramatically since a couple of studies linked it to an increased risk of cancer a few years ago. The report today also says that specialist services should be in place for women under the age of 40 who begin premature menopause. Let's talk to Dr. Melanie Davis, who's a consultant gynaecologist at University College London Hospital and also has worked on the new guidelines, and three women who've gone through the menopause, Nia Fisher, Sujata Barrett and Diane Danzebrink. First of all, Melanie Davis, what is the menopause?
The menopause is when a woman's periods stop, when her ovaries stop producing eggs and stop producing the main female hormone, which is estrogen.
And the symptoms of the menopause?
Well, as a result, about 8 out of 10 women get some symptoms, and about a quarter of them quite severely. Typically, it's hot flushes, night sweats, often muscle and joint pain, mood changes, particularly low mood, and also frequently sexual difficulties. Sometimes those are physical, to do with vaginal dryness, and sometimes psychological, with loss of interest.
Right, so HRT, hormone replacement therapy, can help. What are the risks associated with taking it, though, in terms of cancer specifically?
One thing I should say is that the guideline we've produced tries to look at all approaches to the menopause, not just HRT. It has to be said that hormone replacement therapy is the most effective treatment for these symptoms. The concern has been mainly over cancer risk, and in particular the risk of breast cancer. We've re-examined all of the evidence, and we're really focusing on women who are around the age of 50, going to their doctor with symptoms. For them, over the next 5 to 10 years, there is a risk of breast cancer. It's about 22 in 1,000, to give you some numbers, and that would increase by about 5 per 1,000 for women taking standard HRT.
So sorry, just to be clear, HRT would be responsible for
an extra 5 cases.
An extra 5 cases of breast cancer.
22 expected.
Right, okay, in 1,000 women over 5 years.
Between 5 and 10.
Right, okay,
Typical
okay.
time.
Well, let me ask all three of you, some of you have taken HRT, some not, what you think of those risks and how it affects your choices.
I refuse to take it. I didn't
Because
want
of the
to take
cancer
it.
risk?
Precisely because of the cancer risk.
Even though it's so small?
Indeed, but I didn't want to take any risk because I already have existing illnesses, so I'm putting in a far more amount of chemicals inside my body than necessary or required, and so I turned to alternative therapies using Ayurvedic herbal medicine, and that was far more beneficial.
For you. Okay, Nia, what about you?
Well, I was diagnosed with menopause when I was 35, so for me the pros I thought far outweighed the cons as far as estrogen that my body wasn't producing naturally anymore. And I think it's great in these guidelines that it does mention women under the age of 40, because there is a definite lack of support up until now. Hopefully that will change.
Diane, yours was what's described as a surgical menopause, after a hysterectomy, I think.
Yeah, total hysterectomy, including both my ovaries. So
okay, and so your decision about HRT was what?
my decision initially about HRT was that I chose not to take it, and that was essentially due to a lack of information. So my information was based on the way that some HRT is produced, which is conjugated equine estrogen, and for me, ethically, I could not take that.
Okay, sorry, what was that thing about
Conjugated equine estrogen
is that horse urine?
pregnant mare's urine.
Right, okay, is that true? HRT has pregnant
That's the
horse urine?
original HRT, and
in
in
it.
fact still probably the most widely used around the world. But the modern HRTs are not animal derivatives, and they're much closer to what the body makes. It's estradiol.
Yeah, okay. So the new guidelines today are saying to GPs effectively what?
They're saying have an individual discussion with the women who come to seek your advice.
Well, that's GPs would do that anyway
by this
without new
guidance.
guidelines.
Well, I think GPs were very
I'm sorry,
No,
that's
they
not
don't.
true.
They don't. Really?
I'm
Yeah.
sorry, that's just
Absolutely.
Okay, go on, tell me.
No, I think it's up to each and every individual woman now to make sure that they have access to the right information. In this day and age of the internet and everything else, there are still so many more women who do not have the information that they require, and the GP is the last person possibly that you would get any information
All
from.
you have to do is ask.
Part of the difficulty, Victoria, is that many women, they feel very low by the time they make that appointment and go for that appointment, and when they're turned away or given antidepressants or told, do you know, actually it's just a phase of life, you'll have to get on with it. No.
Okay, Nia, go on, you want to come in?
I was going to say, when I was diagnosed, I was A, in a state of shock, and B, I just lost all my confidence, and even the thought of picking up the phone and making a GP appointment was almost too overwhelming.
Right.
And I did, but once I was in the room, you need somebody to give you the information and to take the reins, because sometimes you're just not in a place where you feel you can do that.
And you were in a state of shock because A, you were young, and B, it's going to affect your fertility.
I'm infertile, yeah. So it was
So what help did
devastating.
you get then?
I didn't get any help as far as the emotional side of it at all. No offer of counselling or pointed in any direction at all. It was all about HRT and about the physical side of it, but that's only a fraction of what you're actually going
That
through.
is really interesting. Yeah, you'd agree. It's a fraction of what's
Absolutely.
you know
For
what's going
me,
on up here as well.
I initially chose not to take the HRT because my information wasn't complete. Eventually, I got to such a low place in my life, I wasn't functioning at all. And I went back to, well, actually, I was taken back to my GP by my wonderful husband. And I sat down, and when we sat down, she said to me, but you don't have to have that equine estrogen. You can have bioidentical estrogen. But I didn't know that. And that hadn't been, at no point, after my hysterectomy, I managed to come out of the hospital within 2 days. That was my choice. I wanted to be out of hospital. I left with absolutely no information.
Okay. All right. I have learned a lot. Thank you so much. Thank you for coming on the programme, Diane, Nia, and Sujata, and Naomi. Thank you very much. On the programme tomorrow, we'll take an in-depth look at the Russian doping scandal, which is